Alright, Shalom, Shalom. I want to give all praise to Yahweh Shem Shai, double honors to the apostles and elders of Great Millstone. Salutations to the Akim out there, spreading this truth like wildfire. Shalom to the Israelite foreigners who look like the other nations, but their spirit bears witness that they're the children of Yahweh Shem Shai. And shalom to the real sisters out there. Alright, today, I woke up and I found today, I titled this live, um, Obamacare Class 2 devices, and you know the the Crown Royal 1984 Witches Brew, digital verification, uh, the mandatory Crown Royal 1984 Witches Brew verification, digital verification. And basically, you know, now, how they got to do it with each other. Now we know. Now we know. You know, y'all remember way back whenever oh, and this was inspired by well, first I actually received actually I saw this message to our chat, that some it's to the Akim chat basically, and the message, one of the brothers was talking about basically his employer is trying to get him to take the jab and shit, and so and also Joe Blow, with this April 19th is this April 19th deadline is no longer on May the 1st. These devils moved it back to April 19th. So now so Esau, he's putting that pressure for you to get that jab, right? He's pulling out all the stops, and he also this AAA. So when I continuing on with basically what inspired me to do this live, and then that kind of like I remembered all that, basically like it occurred to me, like the Yahweh Shimei Shai, he showed me, he showed me like, dude, he's okay, basically he showed me that well, how basically those two are connected, because I went to watch this video by I believe the elder Yasharambo. He's the one that did a video on it. I believe it was him or GMS and Durden Branch, but it was a video on basically Mando C19 jabs. Being forced to take the witch brew, and the verification system, the digital verification system that will prove, basically prove that you took the brew. And one of the issues that they brought up was that basically you could go around, basically you could someone could try to fake it, basically could try to play the system and have like an app that basically acts like looks like those jab those those jab verification apps, verification apps that you basically took that took that required shot, that required dose of that witch's brew, man. Basically, but really you didn't, cause it's falsified. It's fraudulent app, right? And they're already talking about that, and about people doing that shit. I believe on the dark web and shit, people creating uh false, fraudulent, fake apps and shit, like creating apps to basically, you know, but yeah, fake apps. You get the picture, right? And so now, what's gonna be their solution? Who's going into this? The solution would be would be a oh, we gotta put a chip in them. There's no other way. There's no other way. We gotta put a chip in them. It's the only way that they can't be faked, basically, because it's inside you and shit. It's a chip. It's inside you, and then it'll connect to the app. So, the chip that will not, or they'll just scan the chip. If you didn't have a phone, they'll just scan the chip and they'll have it on there. They'd probably do, have some type of system where it basically reads the chip. Oh, he got jabbed. Basically, not even that. How this devil do it. Have some chip reader from like far away and shit. And if you ain't get it, them. You know how Esau do, man. Esau already has some like that probably set up where it will basically, make it impossible to buy and sell. You'll basically it'll basically snitch on you and shit. But anyways, the whole let me get to the point of this live. Basically, the framework was set in that Obamacare law, man. Because you way back in 2013, you actually had a controversy about Obamacare and the RFID chip. The mark of the beast, all that, right? Which it is the mark of the beast. How Obamacare is basically, some people say it was mandatory, making it mandatory, but really, okay, what it was doing was setting the framework for it. That's what it was doing. It was basically saying that they could regulate the use of class 2 devices, which includes RFID chip. That's how this devil does it. This devil will be real vague about some shit. Make his laws real vague so that he can basically claim plausible deniability and be like, no, no, like in this case, no, no, we're talking about pacemakers, but it doesn't say pacemakers, even though that's a type of class 2 device. An RFID chip is also a type of class 2 device. And it was to be used to store medical records, medical information, right? And medical records. What could go towards that? Shot records. Oh, he took the potion. He didn't. That would be in there. Oh, you didn't take the potion. And it really, yeah. You get the picture. So, I'm gonna bring out some info on these class 2 devices. I'm bring out where it's at, and then connect the dots, right? So, class 2 class 2 medical device. What encompasses it? What does it include? We're gonna go into that. Like, hold on. Yeah, it's let me pull up an article on this class 2 medical device. Yeah. All right. Could have been hold on. Class 1, class 2. You have to edit it out and put class 3. May have been in. Hold on. Oh no. I wasn't. Okay, class 1 could be it. Well, then I'd have to edit the title out and put class 1 if that's the case. Class 1 medical device. For includes RFID. I'm just gonna look that up. Class 1 medical device RFID because it actually could include that. It could be class 1 or class 2. Oh shit. This is just, want to study to show myself approved, right? Device class 2. Yep. U.S. Food and Drug Administration. Yep. RFID chip for dental appliance class 2. Implantable, there you go, the first one. Radio frequency transponder system class 2. So wouldn't an RFID chip go under class 2? That would actually go under that. Yep. And what did it talk about? Store medical information. Yep. Got an article. RFID, the FDA. RFID refers to a wireless system composed of two components, tags and readers. A reader is a device that has one or more antennas that emit radio waves and receive signals back from RFID tags. Tags which use radio waves to communicate their identity and other information. Nearby readers can be passive or active. Passive RFID tags are powered by the reader and do not have a battery. Active RFID tags are powered by batteries. Okay, and it can be used to store information, which goes back into it. Oh shit! Right here, uses RFID systems use radio waves at several different frequencies to transfer data. In healthcare and hospital settings, RFID technologies include the following applications: inventory control. So for example, how much jabs was given out? Equipment tracking, that as well, who got it. Well, it's kind of sort of monitoring patients as well. That ensuring that patients receive the correct medications and medical devices. There you go. Even out of bed detection, fall detection. They protect where you are. Monitoring patients, providing data for electronic medical record system. So it's all there, man. Hey, preventing the distribution of counterfeit drugs and medical devices. There you go. There you go. You know, so it's all there, and it was all prepared from the jump. And yeah, information for healthcare professionals. And continue reading on. Because this technology continues to evolve and is more widely used, it's important to keep in mind its information, its potential for interference with pacemakers. Let me find where it says so. What kind of device is an RFID device? Because I remember actually looking into this at the time. Um, yeah, hold on. I think it's class 2 though. I'm not sure. There's potential for interference with pacemakers, implantable cardio, further defibrillators, and other electronic medical devices. Ah, fuck. Ah, fuck. This shit. I'm getting afflicted. This shit hurt. Yeah, I've been going through a lot of afflictions. I ain't been on here that much, y'all notice. Uh, one. RFID data carrier, yep. What type of hmm, could be class 2. Could be class 2. Okay. Mmm. I actually looked that up, and hey, it's all there. Was able to get this article on this PDF. Another hidden secret in Obamacare, yeah. And it actually was going to go into effect in 2013. RFID chip implants. It provided the infrastructure. Damn devils. There's some article by this dude geomagnetics by this site. This dude that run that site. We even have government will establish a national medical device. National medical device. Basically registry. Yeah, I remember. And then there's this article from the horse's mouth. Straight from the horse's mouth. Everything. Oh, it's from 2019. Everything you need to know about radio frequency identification of medical devices. Radio is from NTS. Radio frequency identification, commonly shortened to RFID, is a type of technology impacting the way various industries log and track information attached to products and people. The healthcare world may have the most to gain when it comes to RFID. This how they promoting it. This technology offers at the same. I'm gonna get into it. You're gonna see why. This technology offers some significant benefits that can help improve the quality of care patients receive. In 2014, the value of the global RFID in healthcare market was $66. $6. I'm trying to see where it should say about what type of device is it. Medical devices. Okay. What type of device is it? Limiting personal access. Yeah, I believe so because when I looked up Type 2 RFID chip, Type 2 medical device RFID chip, it was able to pull this up, pull up that article, the other articles. Yeah, hold up, hold up. Where was I at? Where was I at? The way pharmaceuticals are delivered. Hey, they could even just give it. They could give it to you. They could end up giving it to you in one piece. The jab, and they could end up consolidating it. Right now, it's not like that, but they could end up doing that too. Give you the, give you the, like, hey, give you the potion, like little by little type shit, so you get all your doses. The Esau probably has something like that. Probably done cooked it up. If he ain't doing it right now. So basically, yeah, now you get it in one piece. Get it in one piece. Wouldn't be surprised. But yeah, let me get into this article. And as essential, though RFID could impact the way nurses care for patients, the way pharmaceuticals are delivered in many other areas of healthcare are especially valuable. Applications of RFID, an especially valuable application of RFID is in tracking medical devices. Even shit. Medical devices are have a profound impact on healthcare. They're the tools that doctors need and nurses need to provide the best care to patients. This is the right device can help you kill a patient. The wrong device can hurt a patient. Shit. Wrong device or contaminated device called patient great harm. RFID can track medical devices to ensure that the right devices are used at the right time on the right patient state. There's a whole lot of implications with this shit too. In this article, we'll learn about what RFID device is, how the technology works, how it's applied in healthcare, and the benefits and challenges of this technology. As we'll see, testing is a necessary step in ensuring radio frequency identification devices in healthcare are functioning and coexisting properly. So these devils, you know, one of the reasons, basically, is that basically they're saying that it's the answer to all these problems. And oh, this right here on what is a radio frequency identification device. Radio frequency identification is a means of keeping track of objects using digitally encoded tags in digital database that contains the information about every tagged object. In this way, or person even, in this way, RFID technology is similar to barcoding. However, unlike reading barcodes, an RFID reader, also known as an interrogator, interesting, uses radio waves to locate tags and doesn't need to have the tag right in front of it to scan it. The tag doesn't even need to be in the line of sight of the reader. Furthermore, barcodes must be read one at a time, but multiple RFID tags can be read simultaneously. These devils, man, they have it set up. Uh, Radio frequency identification is a useful technology across many industries. Yep. It can be used to track inventory, tools, or other assets. Even people can be tracked using RFID. It goes into Revelation 13. For example, marathons and other racing events using RFID tags to track runners' finish times. As we'll see in the medical industry, patients can be better accounted for using RFID wristbands. That was them programming you, predictive programming. That was them doing. Well, that was conditioning. Well, that was conditioning right there. That was conditioning you to accept that RFID chip. On the wrist of all places. That's what that was. As long as you can place an encoded tag, also called a smart label on something, it can be tracked you through RFID. So this is though many industries have embraced RFID technology, it's most popular in the healthcare sector, where it can be used to track medical instruments, medications, and more. Yep. That's how they're pushing it. And if I'm not mistaken, oh shit. Hey, this article, it also it all connects with what I'm gonna bring out. And let me go into it. Ah shit. Developments, oh, as part I mentioned, developments RFID technology have made it more accessible and affordable. RFID, like other technologies, will continue to be refined in the coming years. In the future, smartphone apps will likely replace traditional RFID tag readers, making the entire process more user-friendly and streamlined. Fuck. Shit. Yo, man, yeah. And then let me pull up the Obamacare medical device registry. It didn't mandate it, but it set the stage for it to be mandated. Okay, hold on.